infection. Watery discharge, blood-stained discharge, back pain, that's when the tumor starts growing backwards towards the rectum. Alright, pain during sex. Why? Because with growth, it attaches itself to the side tissues, and when you have sex friction, it causes pain because the tissues is quite fixed. Problems urinating, problems defecating, because the bladder is in front, the rectum is at the back. Swelling of the legs is important because swelling of the legs means that it's a very advanced stage cancer because it's spread to the side to affect the blood flow to the legs. Alright? What is the symptoms of cervical precancer? We are quite lucky because cervix has this stage called precancer. It means that it has not become cancer yet, but it can become cancer if you don't treat it. Alright? So cervical precancer is otherwise known as cervical dysplasia. In fact, that is what we're trying to look out for when we do pap smears, to look for cervical cells problem. There's no symptoms. It's just like how you have a pimple, alright? It's on your face, you have symptoms, but your pimple internally, you don't touch it, you don't know it, you don't have symptoms, alright? So cervical precancer do not have symptoms. So what is cervical precancer? These are photos taken when I do colposcopy, which means that we put a microscope to examine the cervix. Cervical precancer is whereby the surface of the cervix, the cells grow a bit thicker, alright? It can be divided into 1, 2, and 3. 3 being the most severe, 3 being the chance that it will spread, it will become cancerous in the next 5 years will be very high. That's why if you ever had been diagnosed with CIN, cervical intraepithelial neoplasia, if you have CIN 2 or 3, your doctor will normally recommend treatment. If you have CIN 1, normally we would say, give it some time, this precancer may get better by itself. We would actually observe and make sure it goes away. This, however, is